Hello and welcome to Peace Hospital's podcast. Today, we are addressing a condition that affects millions of people worldwide but often goes unnoticed until it's quite advanced. That is chronic kidney disease or CKD. Joining us today, Dr. Kishore Kumar, consultant nephrologist and kidney transplant physician, having wide expertise in treating and managing chronic kidney disease. In today's episode, he would like to explore what CKD is, its causes, symptoms, and how it impacts people's lives. Dr. Kishore Kumar, thank you for joining us at Peace Hospital's Hitech City.
Thank you for inviting me today. I would like to embark on a journey to unravel the mysteries behind chronic kidney disease. It's a condition that affects millions, yet many remain unaware of its origins and implications until it reaches advanced stages.
Dr. Kishore Kumar, thank you for joining us. Can you give us an overview on what chronic kidney disease means?
It means that the kidney function has decreased and kidneys are not able to do the work which they should do normally. Like normally the kidneys do the most important function of excreting the extra waste products from the body into the urine, and also they remove the excess water from the body. If the kidneys are damaged and they are not functioning normally, these waste products get accumulated in the body and they can have harmful effects on the body. So the chronic kidney disease definition, we say it is an abnormality in the function of the kidney or the structure of the kidney which lasts for more than 3 months. So there are 5 stages in chronic kidney disease. The staging of chronic kidney disease is done by glomerular filtration rate, which is GFR. The glomerular filtration rate is the measure of the kidney function. In our routine practice in the day-to-day clinic, we measure the glomerular filtration rate by serum creatinine levels. We calculate the GFR from the serum creatinine levels in the blood. So there are 5 stages in the chronic kidney disease: stage 1, 2, 3, 4, 5. As the stage increases, GFR falls. GFR in the sense glomerular filtration rate. So what is this GFR? To know what is GFR, we have to know the structure of the kidney. So as we know, we have 2 kidneys in our body, one on each side of the spinal cord, then in the abdominal cavity. Then each kidney has around 1 million units, or the functional units of the kidney, called as nephrons, and each nephron has a part called glomerulus. So the GFR, glomerular filtration rate, glomerular comes from the glomerulus part of the nephron. So in this glomerulus, blood will come and it gets filtered, the urine is formed, and the blood which is filtered returns back to the body. So the filtration of all the glomeruli in the kidney together forms the glomerular filtration rate. So if the kidney does not function normally, this filtration will get affected. As the kidney function is decreasing, the GFR also falls.
What are the most common causes of chronic kidney disease?
The most important causes of chronic kidney disease in the current era are diabetes and hypertension. There are many other causes of chronic kidney disease also, like familial kidney diseases like polycystic kidney disease, which runs in families, or glomerulonephritis. As I've told, what is glomerulus? If the damage occurred to the glomerulus in the kidney, we call the diseases as glomerulonephritis, or sometimes autoimmune diseases like lupus, like systemic lupus erythematosus. This can affect the kidney. Or if the patient has recurrent stones which lead to blockage of the urine which passes from the kidney, this can lead to damage of the kidneys. Or if the patient has recurrent urinary tract infections, or if the patient takes excessive painkillers, over-the-counter painkillers, that can affect the kidney. So these are all the other causes of the chronic kidney disease.
What are some symptoms of CKD that people often overlook?
Generally, chronic kidney disease in majority of the patients will be asymptomatic in the initial stages, and patients tend to present at the later stages of the disease. And symptoms like the following can be present in these patients. Like the patient can have sometimes weight loss, nausea, decreased appetite, weakness, or the patient can have swelling of the legs, or the patient can have early morning facial puffiness, decreased urine output, and excessive itching in the body, These are the some of the common symptoms in chronic kidney disease patients.
What are the primary risk factors for developing chronic kidney disease?
Chronic kidney disease, CKD, can affect any person in life at any time, but some people are more prone for chronic kidney disease. Like I have told, patients who have diabetes and hypertension, if they are uncontrolled, they are more prone for chronic kidney disease, or the patients who have the familial history of chronic kidney disease. So in these patients, because of the genetic abnormalities which run in the families, they are also more prone for the chronic kidney disease, and the further generations can also be affected. And the patients who are overweight and obese, these patients are also at increased risk. Patients who have low birth weight, very low birth weight, in these patients, the kidney reserve, as we say, as the very low birth weight, or the patients who have very preterm birth, their kidneys will not have that many glomeruli as the normal person. So these patients will have less number of glomeruli in their kidneys. As the age increases, these patients are more prone for the chronic kidney disease. And as I've already told, the patients who are having recurrent urinary tract infections, or the patients who have stone disease in the kidney, or who take over-the-counter medications, these are all the patients who are at increased risk of chronic kidney disease.
Doctor, can you discuss the importance of early detection and intervention in managing CKD?
To identify chronic kidney disease, first patient can have symptoms of chronic kidney disease, and the second one we can do is by lab measurements. In the lab, we do the following tests. The first one is complete urine examination. In the complete urine examination, normally we check for if the patient has protein or sugar in the urine, or if the patient is leaking any blood or any pus cells, the white blood cells or red blood cells in the urine, we check. So normal patients does not have any protein or sugar in the urine, and the pus cells or the white blood cells and red blood cells are in very small number. If the patient has chronic kidney disease, they start leaking protein into the urine, and sometimes red blood cells and white blood cells appear in the urine. So this test will tell us that there is some problem in the kidney which is causing the leakage of protein and red blood cells, but this will not tell us what is the disease and what stage it is. So to identify that, next we will measure the kidney function. So we do by doing the blood test. In the blood test, we measure the blood urea and serum creatinine. These tests will be done in the blood, and based on these levels, we will tell the stage of the chronic kidney disease. So as the stage of the CKD increases, the serum creatinine and the blood urea levels increase. And coming to other tests, the next one is the ultrasound examination of the kidneys. So this is also to identify what is the cause of kidney disease in the patient. So in ultrasound, we will try to see whether the kidneys are located in the normal position or not, or if the track of the urine from the kidneys, is it normal or not, is there any blockage of the urine urine track with the stones, or if there is any obstruction of the urine, we will see. And if the kidneys, if they are present, what is their size and what is their location? Is there any abnormality in the structure of the kidney? Sometimes there can be cysts in the kidneys, or there can be a mass in the kidney, or there can be some abscesses. So these type of things will be identified in the ultrasound. So these complete urine examination, blood tests for renal function, and ultrasound are the basic important tests to identify the kidney function and also to stage the kidney disease. And sometimes if the cause of the kidney disease is not known, we may have to do a renal biopsy based on the stage of the kidney disease and the duration of the kidney disease and the presence or absence of protein or red blood cells in the urine. That will help us to identify patients which require renal biopsy or not.
What are the most common complications associated with chronic kidney disease, and how do they impact patients' quality of life?
Now coming to what are the complications of the chronic kidney disease. Let's say patient has a chronic kidney disease and he is living his life. So what can happen to these patients? There are many number of complications which can happen because of the chronic kidney disease. If the kidneys are affected, it leads to high blood pressure in the patients, importantly, and the kidneys are also important to maintain the hemoglobin levels in the blood. So as the kidney fails, the hemoglobin levels fall. And if the patient and the kidneys are damaged, these patients will have excessive accumulation of water in the body, and this can lead to fluid overload, and the fluid overload can lead to excess water accumulation in the lungs, and patient can have difficulty in breathing. And kidney disease patients can also have heart ailments. One of the important cause of mortality or death in patients with kidney failure is heart attack. So these patients are also more prone for heart attacks, and as the kidney failure worsens, the patient will get debilitated, they will have weight loss, they will have weakness, they will have decreased appetite, and they can develop bone weakness. And along with that, the blood levels of calcium and phosphorus, all these will get altered in the body, and these patients are also prone for more number of infections. So all these which I have told are the complications of chronic kidney disease as the time progresses.
What are the treatment options for managing chronic kidney disease?
I'll be telling about the general overview treatment of the chronic kidney disease. The first and the foremost thing to treat a chronic kidney disease patient is to identify the stage of the chronic kidney disease and to identify the cause of the chronic kidney disease, like what has caused his chronic kidney disease, like whether it is diabetes or hypertension, or it is stone disease or an autoimmune disease, or is it a congenital disease or which runs in the families, or is it a urinary tract infection. So first we will identify what is causing the chronic kidney disease, because if we identify the cause and halt that process which is causing the chronic kidney disease, we may stop the progression of the kidney disease at that stage. Okay, so that is the most important thing. So for example, if the patient has diabetes, so we will try to control his blood sugars strictly, and we will try to keep his blood pressures under the control. So this will somewhat decrease the progression of the kidney disease, but it will not end there. So there are many other treatment things which we have to do in these chronic kidney disease patients. The other things which we do is, first we will try to control his diet. With the chronic kidney disease patients, we advise generally less than 1.5 liters of water per day, and along with that we have to restrict salt in these patients, because excessive salt will lead to excessive load on the kidney and it will lead to further damage in the kidneys. So we will ask the patient to take approximately up to 5 grams of salt per day, like a small teaspoon amount of salt in a whole day, including everything which the patient takes, which has to contain less than 5 grams of salt. And the patient has to take more of vegetables and fruits compared to animal food. So we will ask the patient to cut down the animal protein, and we will ask them to take more of the vegetable or the plant sources of the protein. So these are the important things, and then we will ask the patient to increase their physical activity. And then the other things which we will do to halt the progression of the chronic kidney disease patients is, we will try to measure their calcium, phosphorus, or the acid content in their body. As the kidney failure worsens, the acid accumulates in the body. So indirectly, these acid accumulation in the body can be measured by measurement of the serum bicarbonate in the blood. So if the serum bicarbonate is very less, it means that more amount of acid is present in the body. So we treat them with some medications to increase this bicarbonate or to decrease the acid in the body. And we will also give medications to keep their calcium, phosphorus levels in the normal range. And we will measure these hemoglobin in these patients. So as the kidney failure worsens, as I've already told, the kidneys will help to maintain the hemoglobin levels in the body. So as the kidney failure worsens, hemoglobin will fall. So to maintain the hemoglobin levels based on the stage of the patients and based on the hemoglobin and based on the iron multivitamin levels in the body, we will sometimes give them some injections to keep their hemoglobin in the target range. These injections are erythropoietins. The other thing is the dialysis treatment. As the kidney failure worsens, if the patient goes into stage 5 and they develop symptoms like if the patient has decreased urine output, or if the patient develops symptoms of weight loss, weakness, loss of appetite, excessive itching. So these patients require hemodialysis as a treatment option. So without hemodialysis, these symptoms will be worsened and none of the medications will improve these symptoms.
Thank you, Dr. Kishore Kumar, for sharing crucial information regarding the chronic kidney disease to our listeners.
I hope this information can be valuable for the listeners. Remember, knowledge is power, and by understanding the causes, we empower ourselves to take proactive steps towards prevention and early intervention.
If any of you have any further questions regarding chronic kidney disease, please don't hesitate to consult a nephrologist. And remember, early detection through routine blood and urine tests can make a significant difference in managing the disease and maintaining quality of life. We will see you soon with another episode on Pace Hospital's podcast. Until next time, stay informed, stay healthy, and don't hesitate to seek medical advice if you have any concerns. Thank you.